Leslie. What brings you in today? Okay, cough. Alright, well let's start out by viewing your chart here. Are you on any current medications? Okay. And how do you spell that one? I don't see it here on your chart. Oh, there it is. There it is. Okay. Alright. And is the cough a horsey cough or a dry cough? Kind of both? Is there any runny nose with it? No? Headaches? And how long has this cough been going on? 5 months? Wow, that's a long time. Okay. And do you have any allergies that we need to know about? It says here tree nuts and sulfate. Okay, any allergies to any medications that you might know of? Okay. And it says here that you're also due for some blood draw. Would you like me to schedule that for the end of the appointment? No, just to check your vitamin levels and all that stuff. Who knows, your cough may have to do with it. Okay. Are there any other symptoms with the cough? Okay. Okay, and on what date did you visit that clinic? Oh, I'm sorry, that's frustrating. Okay, I'm gonna go ahead and take your blood pressure. This might feel a little bit tight. Can you reach out your arm for me, please? Perfect. Can you lift your sleeve up? Great. There you go. I'm gonna check the system. See what it says. All right, 117/85. All right. Now I'm gonna check your temperature. If you can open your mouth, place this under your tongue, say ah. Okay, good. And can you give me a big inhale and exhale? Inhale. Exhale. Inhale. Exhale. One more time. Inhale. Exhale. Okay, perfect. Now, I'm going to take your pulse. You can reach your wrist out for me, please. Okay. Okay, perfect. All right, Christina. Well, do you have any more questions for me before the doctor comes in? Okay. All right, I will be sure to let the doctor know that we might need that lung exam, to follow up on lab results, to get your blood drawn, check for AHA, and also maybe get you set up with an inhaler. And I don't know, I'm gonna ask the doctor about the mesorbol medication because I think that may help as well. And also ibuprofen and Benadryl, but I'm sure the doctor will have a little bit more to share with you. I'll go ahead and get that exam set up, have the doctor review the results, and she should be in here in a few minutes. All right, thanks, Christina. Bye. Hey, Christina, what's going on? That cough's back again? All right, well, tell me a little bit about the cough. When did you start noticing it? Okay. Well, I would suggest some of the humidifiers that we have, but in your case, since it's been going on so long, I think we may take a different route. Have you been having any sleeping issues with it? Headaches? No? Okay. And do you notice any ear buildup? Because sometimes that can affect your cough. Okay. Oh, and you're having shortness of breath too. Okay. And you haven't had any stressors at work or in your family life? No extra anxiety? Okay. Because a lot of the times it can be anxiety. Yeah. Well, have you tried some herbal tea? Because herbal tea can clear up some of the bacteria in the lungs. Okay, you might want to try that too. Yeah. Would you like to get back on the immeasurable? Okay. And it worked last time, right? Okay. Yeah, I can get you prescribed that again. You're still at the 2 West 1 Pharmacy on Oak Grove? Okay, perfect. All right. Well, do you have any other questions for me? No? Okay. Well, if you wouldn't mind sitting up on the table right there so that I can check some of your breathing. Thank you. I'm gonna go ahead and put some gloves on. Have you been keeping hydrated in this warm weather? Yeah, because that can help too. You must always stay pretty hydrated. Yeah, sorry I was running late today. I also want to put on some hand sanitizer. But yeah, so. Alrighty. Go ahead and relax your body. Sit up nice and tall. I'm going to have you breathe 4 times, okay? In through your nose and out through your mouth, okay? Okay, here we go. Breathe in and breathe out. Breathe in and breathe out. Another time. Breathe in and breathe out. One more time. Breathe in and breathe out. Okay, so it doesn't really look like there's anything wrong with your breathing, but I know sometimes that short-term breathing can just appear out of nowhere, but that doesn't necessarily mean that there's anything wrong with your auto system. So yeah, would you like me to check in your ears for any air buildup? Okay. Okay, hold still. Turn to the left. Perfect. Turn to the right. Okay, so there is a little bit of ear buildup. Would you like the medical assistant to come back in and try to clean that out for you? No? Okay. All right. Well, would you like to do the blow test? It says here that you did the blow test a couple years ago when you were in, where you blow out all the candles. And would you like to have the oxygen inhibitor as well? Okay, I can definitely do that right now. This is gonna be kind of a tight squeeze. Can you put out your arm for me, please? Perfect. Like I said, it's gonna be kind of tight because we really need to get that vein. Okay, perfect. All right, hold really still, okay? All right, perfect. And with that, you should feel a little bit of temporary relief with that breathing. It's not a permanent fix, but this should give you at least a little bit of relief. Also, I would like to check your tonsils just to rule out anything abnormal and a little bit more serious. Okay, open wide. It's going to go above your tongue in the back. Okay, I'm not seeing any abnormalities, no white spots on your tonsils, so that's really good. And if you wouldn't mind, I am going to stick a finger down the back of your throat just to check your gag reflexes. I know patients don't like this part, but it really does give us some good information about your oxygen levels. Okay, perfect. Open real wide. This will be real quick. Okay, perfect. And I'll take that swab and send it out to the lab department. Okay. Did you have any other questions for me? Yes, I will get that inhaler ordered for you. I will get that referral over to a pulmonologist if none of this other works and you're still having the issues, but I did get the blood draw ready for you, and they're gonna check some indicators to rule out anything more serious, which I don't think it is serious, but it might be. No, as far as the AHA, that's not really something to be overly concerned about. just because, you know, it doesn't really relate to this situation, but we can still get it checked, and then I'll review your x-ray results before you leave today. And yeah, so you didn't do the blow test, you didn't do the ear test, but that's okay. Yeah, I mean, the blow test, it's not all that important. I mean, it's mostly older people that do it. I mean, it can tell us some things, but no, I can definitely still give you that inhaler, yeah. But the swab that I took of your throat should actually be more accurate than the blow test, so you're good there. Okay, all right, well, I'm gonna go ahead and order that immeasurable. You're still at the 221. Yes, you are, okay. I'll get that sent off, I'll get that inhaler sent off, and I will get those results from the blood work to you in a few days, but you should have the x-ray results before you leave today, okay? All right, and like I said also, you might just want to try some meditating to ease some anxiety, and herbal tea can help, sometimes Benadryl, okay? Is there any other questions you have for me today? Well, not exactly. Lung cancer is usually associated more with upper stomach pain, and it sounds like yours is more congestion related. I mean, the blood test will rule it out, but I honestly don't think that you have anything serious. I think it's just mild anxiety, along with probably seasonal allergies. But the immeasurable will probably help, since it helped last time, and if it doesn't, I'll still get that referral into a pulmonologist at that point, and they can assess you further and maybe test for some things that we can't test for. All right. Well, if you change your mind and you want to do the ear test or the blow test or whatever, you can definitely schedule another appointment. Yeah. And in addition to checking your breathing and cough, you still are due for a few other IVs, so, but I'll get the rest of this sent out, the swab, the oxygen, and we'll call you with those results all at the same time in a couple of days, so. Okay, do you want to do the ear test right now then real quick before the medical assistant comes back in? Okay, perfect. Okay, well, this will pump water into your ears to get some of that earwax out. Can you lean your head to the side, please? Okay, perfect. I'm just gonna get some water, fill it up here. All right, here we go. All right, here we go. All right, be real still, okay? Okay, we're done with that ear. Can you turn to the other side? Fill it up again. All right, we removed that earwax for you. So that should help a little bit too for some temporary relief. And can you also verify your date of birth for me real quick? Okay, all right. So you're no longer taking the immeasurable, correct? But you'd like to start it up again, okay? Like a wipe to kind of wipe down everything just so your breathing doesn't get worse. Okay, perfect. Yeah, that cough, it sounds like just seasonal allergies, but yeah, I don't think you have anything serious, but like I said, that blood test should rule it out if you do. All right, there you go. Here's a disinfectant wipe. Yeah, once you get your blood draws today, you shouldn't be due for it for another 12 months at least, so you'll be good there. I would just get them done, and I will check the results of that chest x-ray before you leave today, and a few other things. I would like to check your pulse though real quick before I let you go. Is that okay? Okay. I'm gonna check that pulse. Can you put out your wrist for me real quick? And then kind of squeeze it with this. Put out your hand. Okay, perfect. Well, all your vitals look really good. So, yeah, I don't think that we have anything to worry about, but practice meditating, get rid of some stress levels, and I think we'll be okay, all right? Now, the medical assistant will be in here shortly to take you back for the chest x-ray, and then she'll send you on over to labs, and you'll have those results in a couple of days, all right? Yeah, and then I'll call you back with everything else in 2 days. Yeah, we're gonna get you all figured out today, okay? All right, well, it was good catching back up with you, Christina. Okay, all right, I gotta get on to the next patient, but have a great rest of your day, okay? All right, bye. Hi, so I'm Dr. Jekyll Hyde. I'm gonna be your doctor for the day. Starting off, tell me, do you have any allergies that we should know about? Okay, all right, so we're going to be giving you anesthesia and putting you, getting you ready for the surgery. And before we do that, I would like you to fill out some paperwork for me, please. You're gonna date and sign right there. And then once we get that signature, here's a pen, we can start our process. Do you have any questions for me? Well, yes, let me bring up your chart. I am aware that they had put you on the immeasurable 1,000 milligrams. Does that sound right? Okay. Oh, are you done with the signature? Perfect, thank you. I'll give that to my assistant. Now, so you don't have any allergic reactions to any kind of anesthesia? Okay, good. The procedure takes around an hour from the time of incision to the time you're completely sewed back up, so you'll be asleep for about, I would say, an hour an hour and 15 minutes maybe. Yeah, it's a pretty quick procedure. And it's a pretty common one too, so there's no need to be nervous. Just we always have our patients do a little meditation exercise right after we give them the anesthesia, and it helps them fall asleep. Now, a number one fear is that you're not going to wake up, and the second fear is that you'll wake up while they're still cutting on you. But neither one of those are true. There's been millions and millions of surgeries, and I don't think that's ever happened. So, yeah. Would you mind if I took your vitals real quick? Okay. Can you open your mouth real wide for me? Say, Okay, everything looks good there. I'm gonna go ahead and put my gloves on. How was your weekend? Good. Oh, mine was okay. I took my daughter to the pool, and then my father-in-law came up to visit, and we cooked out. So it was a pretty nice weekend. Can't complain. I bet you had this in the back of your mind the whole weekend though. You'll do great. And when you wake up, some people can feel a little queasy, a little nauseous. That's also why I asked you about the allergies, because we don't want to give you anything that's gonna send your body into overdrive and make you throw up. So we'll just play it by ear when we get there. So Alrighty, and this is your first surgery, right? Okay. Yeah, I'll be the attending physician during the actual operation. And my associate, Tom, is going to be the actual doctor. And then let's see here. George is going to be your anesthesiologist today. So they should be in a minute. Have they greeted themselves yet? No? They should be in shortly. All right, so what I want you to do is just sit and relax. I know that's hard sometimes, but we've got about 20 minutes before we're gonna start prepping you. Can I go ahead and get your heart rate? All right, thank you. We just have to have a few of these things documented by law, legally. All right. Breathe in really, really slow through your nose. Breathe in. 1, 2, 3, 4, 5. And out through your mouth. 1, 2, 3, 4, 5. And again. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Okay, again. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. One more time. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. All right, everything sounds pretty good. And let me look up your most recent labs and blood work. All right. Well, it looks like you may be due for another blood draw. Hold on a minute. Okay, but we'll do the surgery today. I don't want to overwhelm you. And then maybe in about a month or so, we can create that follow-up appointment for some more labs and blood work and see how everything's healing and all that. And did they talk to you about a post-op therapist? Okay, I'm sure they'll go over that at some point too, before you leave. All right, well, I'm gonna go ahead and go get the anesthesiologist, okay? And he can introduce himself real quick. I think, yeah, he's off. He should be off lunch in just a minute. Okay, so I'm actually going to be the anesthesiologist today because our anesthesiologist had a family emergency, and don't worry, I am dual trained in anesthesiology as well as surgery, specifically upper stomach surgery with ulcers and digestive tract and all of that. So you're in good hands. All right, it's about time. Would you mind laying up on this cot here? All right, and I am going to go ahead and give you the anesthesia, okay? So hold really still for me. Oh, it should take around 5 minutes for you to fall asleep completely, but just know you're not gonna even know you're asleep. You're not gonna know you're getting surgery, and then in an hour or so, you're gonna be up and it'll be all over with, so. All right, let me go ahead and get this into your system. Can you reach your arm a little bit this way? Thank you so much. Take that in. I'm gonna listen to your heart while I do it, okay? Stay really still. Okay. Gonna get all of that in your system here. Okay. Now, I'm going to actually tie your other hand up. I'm going to tie it with a band here because we really need to, just a second, I'll be right back. All right, so I'm gonna wrap this band around your arm really tight here. You're gonna feel a little bit of a squeeze. All right, now I'm going to give you the second shot. It's just gonna be a quick pinch. This isn't gonna inject anything. Just a little pinch, okay? Are you ready? Okay, 1, 2, 3, and out. Perfect, okay. Now, you should start feeling groggy. I am gonna do a brief little meditation with you. Are you nervous? Don't be nervous. It'll be okay. My husband just got done getting 2 surgeries back to back. On his stomach lining was off, and he was nervous too, but I'm in the medical field, and I assured him it wasn't anything at all to be worried about. I am going to go ahead and wipe down the area that we are going to be operating on. So I'm going to go ahead and, can you pull your gown a little bit? I'm going to go ahead and rub your upper stomach with this. Just get it nice and good. Okay, perfect. And I'm going to take some hand sanitizer here, get all sanitized. All right, how are you feeling now? Are you okay? Getting a little sleepy? Okay, that's good. That's what we want to hear. Okay. All right. Don't be nervous. You're gonna be fine. Okay? Take a deep breath in, and I want you to take a deep breath in for 5, hold for 5, and breathe out through your mouth for 5, okay? And we're gonna do this until you fall asleep, okay? 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3, 4, 5. Okay, it looks like you're getting really sleepy here. Okay, it looks like you're asleep. All right, I'm going to tilt your head so that you're not laying so uncomfortable here. I'm going to take that band off of your arm now. All right, give me a thumbs up if you're not completely asleep. Okay, I think she's ready to go. All right, let me put a new set of gloves on so that we can operate. Yeah. What tool do you need first? Okay. Just a second. Okay. What tool do you need? Okay. Here you go. Here's that tool. Okay. And then you need the shrunk next. Okay. Here's the shrunk. Okay. Is there anything else that you need? Okay, I'll check her pulse real quick. Yeah, 850 over 2, right on track. Okay. All right. Just let me know what else you need. The anesthesia looks to be performing pretty well right now, so yeah. So we've got about 60 minutes, and then slowly wake her up. Yeah. Wait, what do you need? Okay, here you go. You're perfect. Yeah. Well, I'm gonna wipe down these surfaces here. just a little bit. So when she wakes up, it can be all nice and fresh for her. So, what do you need now? Absorbent cloth? Okay. Just a minute, I'm getting some. Here you go. And when is her pre-op is, okay, right on, okay, good. Yes, I'm gonna go ahead and take these gloves off again. You shouldn't need anything else, right? Is that about it for the, okay. And if you do, just holler at me and I'll put my gloves back on, okay? Thanks. Turn these back inside out. Is she breathing okay? Okay, good. Yeah, I can definitely put pressure there. Do you want me to tie her okay, I'll tie her bottom leg up to help that circulation. Okay, I'm just gonna put pressure on it for a few minutes. Is she good to go? Okay, perfect. I'm gonna go back to filling in some of her basic information. Don't forget to holler at me if you need something else. Okay, perfect. And we will need her to finish filling this out afterwards. And she can come back and do it in a few days. She's probably going to be pretty groggy when she wakes up, but I'm going to do my part. Go ahead and fill this out for her. She's still getting enough oxygen? Okay, great. And we will need both of your signatures. Okay, yeah. Right, perfect. Let me log that I've gotten that taken care of. What do you need? The canna dude? Okay, just a second. Let me put these gloves back on. Sorry. Okay, let me put them back on. I'll go search in the closet. I know that she had left some in there. She, as in Lisa, had left some in there the other day, so I'm gonna go check real quick, make sure. Okay. Oh, no, here they are. Hold on. Let me get one for you. Which kind do you need? Okay. There you go. Yes, I can definitely put more pressure on her leg. She's doing really, really well. She was so afraid of the anesthesia, but she's doing very well. She fell asleep before I even had time to get halfway through the breathing exercises, so yeah. She good? Okay, perfect. Yeah, I can check the monitor. Yep, steady, right on target. All right. Take these back off. Just holler again if you need anything. I'm going to sterilize some of these and sterilize the anesthesia tool here. Sterilize the gloves a little bit. Sterilize the shot that I gave her. I miss our paper ones that we could just throw away, but I don't know why they switched back to these. Yeah. No, I checked her temperature beforehand. That was really good. Okay. All right. She good? Oh, you think you're gonna finish up sooner? Oh, that's awesome. Okay. Let me log that here. Let me contact the medical transcriptionist and get some, yeah, I thought I had my headset here near me. Yeah, I'll just use, hold on a second. Yeah, I'm gonna contact Tracy, the medical transcriptionist, so I can get this ticket started. I know she works today. Yeah, she's here today. And she's on this case. This is her caseload. Okay, good. Okay. Go ahead and get started. Let me know if you need anything. Okay. Okay, Tracy, can you hear me? Okay, perfect. All right. Yep, I'm ready. Yeah, there's a walkie-talkie on Greg, the one who's doing most of the surgery here, and she's copying what he's saying word for word. I can't hear because they generally tend to be very soft. But you're doing so good shadowing and training, so are you sure you still want to do surgery in your career? Nice. What kind of surgery are you looking towards? Ulcers, upper stomach issues? That's what I went into. How many years of school do you have left? Hold on a second. Okay. Oh, you need something? Okay. 1 second. And sometimes you have to go back and forth a lot. It doesn't happen often, but especially with these upper stomach issues, a lot of the times you will have to jump in at times. Get this back on. Oh, these gloves are so stubborn. And sometimes we don't even put our gloves back on. If it's a real life-threatening emergency, we just go on in. We have to. Normally we try not to take our gloves off in the first place, but I had some record keeping to keep up with. Okay, let's see. What do you need? Okay, here you go. Yeah, I can hold the press down on that part. Just let me know when. All right, perfect. Oh yeah, that's fine. That's okay. Yeah, her vitals still look perfectly fine. The medicine's doing its job there. Okay. All right. Oh, you're done working on her now? Perfect. All right. Oh, yes. Here, you can sew her back up with this. Okay. All right, see? Those surgeries, they don't take long at all. We just get in there, do what we need to do, and out the door. That's the beauty about the gastroenterology and digestion department, is we don't have a lot of surgeries, like especially plastic surgeries in the burn center. I mean, those surgeries can last 24 hours straight. So, yeah, let me feel her heart rate again. Make sure she's gonna be able to ease out of that smoothly. Yep, everything sounds good. Let me stick this down her throat to make sure she's not. Okay, yep, everything looks good. So she should be up in around 20 minutes maybe. I'm gonna lock all this in. Yeah, and then cutting them open and sewing them up is the easy part. I mean, that's lickety split. So this was, I mean, we got that one done quick. Was it pretty minor? That's good. Yeah, she was so nervous. I was like, it's gonna be so quick, you're not even gonna know you're out. All right, well, I'm gonna go ahead and grab some lunch and I'll be back to monitor her more. Okay, perfect. Oh, no, Tracy. Yeah, we got it. Okay, thanks. Bye. Okay, guys, so that was my rendition of an anesthesiologist slash surgical tech. But I just wanted to do something else with gloves because I had some requests for that. And so yeah, make sure to like, comment, and subscribe, and be thinking of ideas that you would like to see. And if you're one of my subscribers, I will make sure to do that. And right now I'm posting every day. So peace. Hi, how are you? Okay, great. Okay, so I'm going to be the intake person for you today, and I'm just going to start out by getting some basic information. Okay. Yes, perfect. What is your name for me, Anne? Can you spell that for me, please? Tessa. Okay, perfect. And what's your last name? Smith, Smith. Okay, perfect. And let me pull up your medical records here. What's your date of birth? Okay. Alright, so this is your first surgery. Okay. This is one of the most routine procedures that we do. Okay, let me go ahead and get my hands all. There we go. Okay, now just relax. Don't need anything from you, but just to relax right now, okay? I'm gonna go ahead and take some vitals for you before I start injecting medication. And for sensory issues, especially for our brain cancer patients, we do like to ask if you prefer whispering or just calm speaking. Okay, so I can calmly speak. Okay, perfect. Perfect. Okay, here we go. These gloves are not wanting to come on now. Okay, there we go. Another one. Now, have you eaten anything in the last 24 hours? Okay, good. You've been keeping really hydrated. Okay, perfect. That's what we like to hear. Let's see here. Alrighty. Can you just open your mouth real quick so I can go ahead and get your temperature? Place that underneath your tongue there. Say ah. Perfect. Okay. And also what we're gonna do is I'm gonna go ahead and take your blood pressure. So put out your arm for me, please. This might feel a little tight. Okay, looks good. So those are really all the vitals that I'm needing right now. But what I am gonna do is I'm gonna go ahead and wipe down the top of your head, okay? So you already have your head shaved, that's really good. I am going to go ahead and wipe off the spot that they're going to be operating on for the incision. Just hold your head real still there. Perfect. Kind of cold, huh? Yeah. Can be kind of a shock. Okay. Now, what I'm going to do is I'm going to kind of wipe off the area that you're laying. And I'm going to wipe off your arm here where we're going to put the incision in for the anesthesia. Perfect. All right. Now I'm going to go ahead and do the anesthesia, okay? Let me get my mask on for this part. All right. All right, hold real still for me, okay? I'm going to go ahead and start the anesthesia, and from the point that it's administered to the point of falling asleep should be around a half hour, okay? That's why I'm giving you a dosage that progresses mildly, so you're not gonna fall asleep before the doctor gets here, okay? All right, put your arm out, please. Begin. Perfect. You might hear some tapping. Totally normal. All right. Looks like everything's administered. You're going to start feeling a little groggy, and I'm going to go step out and let the doctor know that it's administered, and then I'll come back to monitor a little bit, okay? All right, now that we've administered that, let me go ahead and check your pulse and your heart rate real quick. Stay real still for me. Perfect. Looks like we're still on track. Okay, I'm gonna go get that doctor, all right? I'll be right back. Hi, I'm gonna be your doctor today. I'm gonna be the surgeon who's gonna be operating on you. And then I have my assistant over here. She's gonna be assisting me with the surgery. Now, I really don't want you to be nervous for this. I know brain surgery is a very scary thing, but you're in the right place and you're doing the right thing for yourself. This is probably one of the most scary things you're ever going to go through, but we're here to make it not as scary, okay? And I saw your vitals just now. I saw all your intake information and everything's looking great. So the anesthesiologist told me she went ahead and administered your anesthesia. So you should be asleep here in about 15 minutes. Are you feeling groggy at all? Okay, perfect. All right, and what I usually do with my patients is I do a quick meditation with them so that they're not as nervous and they can easily fall asleep. Now, do you have any questions for me before we begin the meditation? Okay, well, generally with the tumor that you have with the brain surgery, we have a 99.8% success rate on not only retrieving the tumor, but in having the cancer go away for at least the next 10 years. And you're young, so it should probably never come back. So that's really good news. And this is a routine procedure. I just got done doing one about 10 minutes ago. I see it every day. You're in really good hands. Now the anesthesia, you are gonna wake back up, so don't worry about that. You're not gonna wake up while we're operating on you. The only concern, honestly, that I have at this point is feeling nauseous when you wake up. Okay, your head's not gonna hurt, nothing's gonna hurt, but I am a little concerned about that. So I was gonna ask you, do you know if there's any types of medication that you're allergic to or that you've thrown up before? Okay, and this is your first surgery, right? Okay. Yep, it's good that you're here and we're taking care of it now while you're young. Get that taken care of. And now after the surgery, I know you probably don't want to hear all of this right now, and I will repeat it afterwards, but you're going to want to hold that ice pack on the part where we operated, and you're not going to want to jump, run, walk around for at least 2 weeks, okay? All right. Well, I'm going to go ahead and get started with the meditation. I hope your fears are eased just a little bit. Alrighty. So go ahead and lay your head back on the pillow, okay? And I'm going to feel your heartbeat as I'm guiding you through the meditation, okay? All right, hold really still. And I'm gonna have you breathe in for 5 through your nose, really deep breaths. Hold it for 5, and then breathe out for 7, and then hold your breath again for 5, and then repeat. In for 5 through your nose, hold your breath for 5, blow out for 7 through your mouth, and then hold your breath for 5 again. And when you breathe in and out, I really want you to focus on your stomach and breathing all the way down and up through your stomach, okay? All right, now I'm gonna go ahead and breathe with you, okay? So here we go. When I count to 3, we're gonna start, okay? 1, 2, 3, breathe. 2, 3, 4, 5, hold. 1, 2, 3, 4, 5, and out through your mouth. 2, 3, 4, 5, 6, 7, hold. 1, 2, 3, 4, 5, big deep breath in. 1, 2, 3, 4, 5, hold. 1, 2, 3, 4, 5, out, exhale out, big exhale. 1, 2, 3, 4, 5, 6, 7, hold. 1, 2, 3, 4, 5, inhale. 1, 2, 3, 4, 5, hold. 1, 2, 3, 4, 5, exhale out through your mouth. 1, 2, 3, 4, 5, 6, 7, hold. 1, 2, 3, 4, 5, big inhale in through your nose. 1, 2, 3, 4, 5, hold. 1, 2, 3, 4, 5, out through your mouth. 1, 2, 3, 4, 5, 6, 7. Okay. is doing really well. Looks really good. So, are you feeling a little bit more relaxed right now? Yeah. It'll be over before you know it. You'll be asleep, and in no time, you'll be up, and we'll be icing you and get you that medicine, okay? And we're gonna monitor your nausea rates afterwards as well, okay? So you're probably gonna stay overnight, but then we'll contact your person who's gonna drive you home and give them all the post-op instructions as well, okay? And after your surgery, we're gonna continue the post-op once a week by having a home health nurse come in and check on you, okay? Because we want you to not really leave your bed for at least 2 whole weeks, okay? Get a lot of sleep, a lot of water. Alright, okay. So, we're gonna repeat all this information to you, don't worry. I just thought I would tell you now to kind of ease your fears. We are gonna be continuing to take care of you. So, what I'm gonna do is I'm gonna breathe over your forehead right now to kind of cool you down even more. And while I'm doing that, I want you to close your eyes and relax, okay? Here I go. I'm gonna put pressure on your hands here. Okay, squeeze my hand back if you can still hear me. Can you still hear my voice? Okay. Okay, I think she's ready. She's ready for incision. She's asleep. Perfect. Okay. Alright. Now, can you monitor her pulse during this? Okay, perfect. I'm going to go ahead and make the incision. Yeah, I'm going to go ahead and make the incision on her head. Okay. Here's her head. I'm going to do. Okay. Okay. Incision is made. Can you hand me the sterile wipes real quick? Perfect. Okay, now can you hand me the knife? Thank you. Right, I'm gonna just go in there gently and just kind of remove some of those neural cords out of the way. Can you hand me the scissors? Okay. I'm gonna cut them back. Okay, there's the tumor. I'm gonna go ahead and dig in there and try to get it out. How's her heart rate doing? Okay, perfect. Okay, I've got the tumor. Let me make sure there's nothing else in here. Okay, perfect. We've got her all scraped out. I'm gonna go in there and put some gauze in there, the self-dissolving gauze, just to prevent any bleeding internally. Okay. Okay, I'm gonna press on her forehead also. Okay, perfect. Alright, now let me try to sew them up. Here we go. Okay. Can you hand me the wrench, please? Thank you. Let me just make sure there's nothing else remaining in here. Okay, everything looks really, really good. Okay. Can you hand me the knife so I can sew her back up? Perfect. Okay, I'm gonna sew her back up here. Okay, perfect. I'm gonna put pressure on that now. Now we should almost be good to go. Okay. She shouldn't be waking up for another 10 minutes or so. So let me go ahead and monitor her slowly before she wakes up. Okay. Okay, her heartbeat's good, her pulse is good, her breathing's good. Okay, perfect. Alright, let's get no complications. I'm gonna go across the hall here, and if you could stay here and monitor her until the anesthesia wears off, that'd be great. Alright.
most patients don't want anything for around a couple of hours after they wake up. So I'm gonna go ahead and check your heart rate again. Hold real still for me. Okay, perfect. So we shouldn't need to administer anything else because we did that before you woke up. So you should be good to go. I am gonna go ahead and check inside your mouth again just to make sure nothing's leaking down. Okay. Open up for me, say ah. It's gonna go right into your tongue. Beautiful. Okay, perfect. Yeah, it doesn't look like there was any trouble at all. Can I look inside your ears real quick? Okay. Alright, do you have some ear wax built up? Would you like me to get that out real quick while you're still numbed? Okay, perfect. Okay, hold real still. I'm gonna get that ear wax out. Okay, turn to the side. Okay, got all that ear wax out. I'm gonna kind of drain some with this. Okay, perfect. Now please lean your head back for me, okay? Alright, perfect. Okay, you did so good today. We're so proud of you. The doctor's gonna be back in here, okay? My job was just to monitor you right after you woke up, but I will be in here about an hour later unless you call me for extreme nausea or something like that. Okay. Alright, you did such a beautiful job. Alright, we'll see you next time. Hopefully there's not a next time, but alright. Okay, you did so good. Alright, perfect. Okay, bye-bye.
Hi, my name's Stacy, and I'm going to be your intake coordinator for today. We're with Optum Health. What brings you in today? Okay, hold that thought 1 second. Can I get your first name, please? Your last name? Okay. Do you have a good phone number that we can have? Okay. And what's your address? Okay. Email, if you'd like us to send you updates and surveys. Okay. Okay, perfect. So what's going on? What brings you in here today? Okay. While you're talking to me, I'm gonna go ahead and get your blood pressure. You can go ahead and put your arm out for me, please. Perfect. Leave my gloves over here. I'm gonna check your heart rate as well. Let's have that pumping for you. All right, 180/70. Perfect. Hold real still for me. Breathe in through your nose, big breath, and out through your mouth. One more time, in and out. Perfect, okay. Alrighty. So let me get your data pulled up. Alright. Okay, so I'm gonna go ahead and ask you some basic questions that they require all of us to ask, just a little brief assessment. And I want you to answer honestly, okay? Is Mom gonna be the only one with you in here today? Okay, perfect. And are there any medications that I need to know about? Are you currently on any medications at the moment? Okay. And do you have any known allergies that you're aware of? No? Okay. Mom, do you know of any allergies? Okay, that's perfectly fine. Alrighty. And how would you describe your current mood right at this moment? Okay. Alright. So on a scale of 1 to 10, 10 being completely hopeless and 1 being feeling fine and relaxed, where are you today? A 10? Wow, okay. Any trouble sleeping, falling asleep, staying asleep, sleeping through the night, anything like that? No? Okay. Any appetite changes? No? Okay. How's your energy level right now? Okay. And let's see here. Any trouble concentrating, focusing? No? Okay. And what's your state of employment? Okay. Are you married, divorced, widowed, or single? Single? Great. Okay, now we're going to move on to some more important safety questions. At this current moment, are you having thoughts of harming yourself or anyone else? Okay. Let's see here. Any self-harm lately? No? Okay. Okay. Do you often feel nervous, anxious, or on the edge? Okay. Do you currently have any physical symptoms like heart racing, sweating, or any shakiness at all? No? Okay. Any panic attacks recently? Okay. Have you been taking your medication on time like you're supposed to? Okay. And who's your psychiatrist? Do you have a therapist? No? Okay, it's probably good to talk to someone, yeah. But if we schedule you to intake or inpatient today, they should set you up with one. So I think that would be good to have. And through Optum, we have some really good counselors. Okay. Let's see here. All right, not too many more questions. Let's see here. All right. Any headaches, stomach aches, delusions, hallucinations, hearing things, vision problems, hearing issues? No? Okay, great. Okay, and you did make some comments about wanting to hurt yourself. On a scale of 1 to 10, how serious are you about acting those out right now? Okay, that's pretty high. So here's the thing. We're required by law to send you to inpatient, to our inpatient program, because you did make some concerning statements about wanting to harm yourself, and we don't want to send a patient away feeling like that. So you will be sent to our 72-hour inpatient program, and depending on your progress, the psychiatrist and your social worker may choose to keep you longer, okay? Now, when you're in there, you will be assigned a social worker. They're great. They'll help you through everything. You'll meet with a psychiatrist every single day. And they'll also set you up with aftercare, such as a therapist and a counselor and all that, okay? Do you have any questions for me? There will be groups and activities every day, yes. Mom, do you have any questions? No? Okay. All right, don't be nervous. You're a really good candidate for this. I think it's gonna help you a lot, okay? I really do think it's gonna help you a lot. They're gonna get you all set up. They're probably gonna do a few blood draws and then get you going on your way, okay? All right, let me go ahead and enter this info in here. You're going into inpatient today. you eaten yet today? Okay. Have you had dinner? Okay, I'll request that one of the nurses or the techs bring you some dinner to your room once they assign you, so you can go ahead and eat. I think it's past dinner time, but they'll go ahead and deliver something for you, okay? All right. And you can go ahead and sign this form letting them know what you'd like to eat. Here are the choices here on this sheet, and if you'll just circle one for them, that'd be great, okay? Alrighty. Perfect, thank you. Okay, I'll get this over to them. And Mom, if you could sign this upper portion here, that'd be great since she is a minor. Okay. No, it's a really great program. Yeah. I have a niece that went through the program and she gained so much from it, so it's really great. Okay. And I'm gonna go ahead and sign off here. Okay. All right. Thank you for being honest with me today. So all your vitals look good, blood pressure looks good, temperature is good. I'll let them know that. And they are probably going to in some blood draws, and they'll ask you more questions about your overall health once you're in there. They do have to do an all-over body scan just to be sure that it's safe for everyone in there. It only lasts a couple seconds, and then they'll look quickly and then it'll be done. They do this all day, every day. They don't think anything of it. All right, let me call down to the tech who's gonna come get you and lead you over to inpatient. Okay, just 1 minute. Hey, Susie. Yeah, we've got an inpatient here. Yeah, we have an intake. Yeah, we're transferring her over to the psychiatric hospital section. Okay. All right, perfect. Okay, thanks. Bye. All right, so a social worker is actually gonna come meet us and take you on over there, okay? And Mom, you can't go back into the inpatient center with her, but at some point during her stay towards the end, there is a chance for a family conference, so then you'll get to meet her there, okay? Okay. Any last minute questions for me before the social worker arrives? No? Okay. All right, well, thank you so much for your patience and cooperation today. I'm going to give this over to the social worker to sign, and we should be good to go. Thank you so much. Bye. Hi, I'm going to be your social worker today. Can I get your first and last name, please? Annalie. Annalie, what's your last name? Cornett. Okay, and what's a good phone number for you? Date of birth 8/15/2001. Okay. And Annalie, we do require that you put this gown on while you're here, okay? So just put the rest of your clothes in this sack so they're heated, and we'll be back in shortly, okay? Okay, perfect. Okay. Now, I want you to tell me a little bit about how you're feeling right now and what caused these thoughts of self-harm. Okay. Okay. Yeah, so I do know what happened. Got recorded here that you called into the crisis line and made some concerning statements, and then the phone disconnected. And you were transferred here by the paramedics, is that correct? Okay. Okay, so with that information, I'm not comfortable sending you home tonight. So I do think that it's best that we figure out a plan. We're leaning towards 72-hour hold in our inpatient psych section. Okay. Well, yeah, but by law, we're kind of required to do this. And so are you still feeling that way right now? Okay. Okay. But based on the fact that you were brought here by a medical team, I'm not comfortable sending you home tonight. Do you live alone in an apartment? Okay. Are you still at the 9185 North Terrace address? Okay. Do you have anyone that would be willing to come pick you up that you could spend the night with? We're just not comfortable sending you home by yourself right now. You don't? Okay. Okay. Okay, that's fine, but we are gonna have to send you to our inpatient, okay? I'm not sure. That depends on what the psychiatrist and the medical staff there deems necessary. You could be in there longer than 72 hours, but I don't have control over that. Do you want to tell me a little bit more about what's gotten you so upset today? Okay. Okay, well, our prerogative right at this minute is getting you to safety. We want you to be safe, so we're gonna go ahead and send you to inpatient. There'll be a counselor on site if you need to use her at any point. They will give you a psychiatrist to meet with every day, and he can go ahead and assess what medications you're on and see if they're appropriate or if you may need new ones. And they'll also set up aftercare for you. So they'll provide you with a therapist if you don't already have one. They'll assign you to a new psychiatrist if you want that. But yeah, it says here that you're on the bupropion medication. Is that correct? You're still on that? Okay, are you taking them regularly like you need to? Are you sure you didn't miss a pill recently? Okay. Oh, you have the medication with you? Okay. If you want to give me that, I can look it over. Thank you. Okay. Yep, so bupropion, 300 milligram tablets, 1 tablet by mouth every morning. And when you get to inpatient, they are going to request that, or they're going to require that you give them your pills. So they're going to confiscate any pills that you may have on your person, and they're going to save it up at the front desk with them, and then call you when it's time for you to take your medicine every morning, okay? And then they'll administer it to you. Well, that's just the protocol. They want to, it's for safety precautions. But yeah, that's how they'll do it. Yeah, so that's how that's gonna go. Do you have any questions, comments, or concerns for me? Okay. I know you're upset, but I really think this will be the best thing for you. You'll get aftercare options, maybe on some new medication that will work better. You'll get to talk more about your feelings. They have activities and groups. So yeah, I don't know if they're going to diagnose you with anything. That's not in my wheelhouse. They do have psychologists on site, but whether they choose to provide you with one, I'm not sure. A trusted family member or friend can bring you a change of clothes while you're in there. But as far as that, we cannot allow you to leave our care for the next at least 72 hours as of now. So yeah, you'll be able to have your phone on the right over there, but like I said, once you get to inpatient, they're going to confiscate pretty much everything. And they'll do skin checks and all that. So yeah, I don't know, some places have you wear scrubs and some places don't. I'm not sure what they're doing right now as far as that goes, but okay. Alright, well, I really hope you get to feeling better, and hopefully this inpatient stay will help you out a little bit, okay? We just really want to make sure that everybody's safe, okay? Alright, any last minute questions, comments, concerns? I think the truck's gonna be here in about 15 minutes and pick you up. Would you like to do a little meditation to calm you down a little bit before they arrive? Okay. Is it okay if I place my hand on your upper abdomen while we do this? Okay, perfect. Okay, so we're gonna do a big breath in through your upper stomach for 5, hold for 5, and then out for 5, okay? All right, so give me that big deep breath. 1, 2, 3, 4, 5. Hold 1, 2, 3, 4, 5. And release. 1, 2, 3, 4, 5. Okay, let's do it again. Breathe 1, 2, 3, 4, 5. Hold 1, 2, 3, 4, 5. Exhale 1, 2, 3, 4, 5. Okay, again. 2, 3, 4, 5. Hold 1, 2, 3, 4, 5. Release 1, 2, 3, 4, 5. And again, big deep breath in. 1, 2, 3, 4, 5. Hold 1, 2, 3, 4, 5. And release 1, 2, 3, 4, 5. One more time. Big deep breath. 1, 2, 3, 4, 5. Hold 1, 2, 3, 4, 5, and release 2, 3, 4, 5. Okay, good job. Are you feeling a little bit calmer now? No? It'll be all right. It'll be all right. I'm sorry, what? Oh, is the truck already here? Okay. All right. Are you going to bring the stretcher out to transport her? Okay. Okay, perfect. All right. If you want to go ahead and put your clothes back on, the truck's arriving now. Just place your scrubs back in that sack and we should be good to go, okay? I hope you get to feeling better. All right, good luck. Okay, bye-bye. Hi, I'm the rheumatologist. My name is Catherine Ben. So, tell me a little bit about why you're in here. Okay. So a lot of joint pain. Okay, and where is the joint pain most prominent, or is it just all over? Okay. Mostly in your elbows. Okay. All right. Well, it does say that you. Let's see here. A little piece of paper here. The medical assistant said that you have really bad elbow and knee pain, and this was faxed in, the bottom half was faxed in by your primary care, and they're saying that you have really low vitamin D and high ANA. Does that sound correct? Okay. All right, well, it looks like they took a blood test, a blood draw, and what kind of vitamin D did they prescribe you? Okay, I'm gonna go ahead and switch you over to the actual pill that you have to pick up at a pharmacy. because I believe that the gummies are not going to be as effective right now, at least until we get that vitamin D up to where it's supposed to be, and then you can go on to those vitamins. Okay, so that's the first thing I'm going to do. Let me write that down for you here. Alright, and I did look over some of your ultrasound images of your knee and your elbow, and it does look like you have very slight osteo. Sorry. Looks like you have very slight osteo in both knees and mild osteo in both elbows. So that's pretty typical for a 61-year-old. But yeah, so, and the ANA doesn't mean anything. I see that all the time. But what we can do is, if you're really concerned about lupus and other kinds of diseases, autoimmune diseases, we can do a more thorough blood draw here, just to make sure that you're in the clear. But from what you've described, I don't think that it's anything to be too concerned about. Okay? Alright. If you wouldn't mind real quick though, I would like to go back to kind of tap on your knees and elbow just to make sure that they're responding well. Okay? Yeah, to me, there's good bone tissue there. I just think that it's just a normal part of aging. I don't think you have any autoimmune issues. So I think it's mostly the vitamin D. I do. And remember to watch your diet, go on walks in the sun, and yeah, I just remember to limit the breads and sugar that you eat, and really stock up on the protein. Okay, that'll help your bone health. I do want to go ahead and take some vitals real quick though, and then we'll get to that blood draw. Okay. Okay. How's your week been? That's good. Mine's been a little hectic. My husband, 3 kids all day this week while I'm on shift, but I've come home and the house has been messy each time, but oh well, that's what weekends are for, right? Alright, so I'm going to go ahead and hear your heartbeat. Make sure that that's all on par. If you can give me a really deep breath in for 5 and out for 5. Okay? 1, 2, 3, 4, 5. Out, 2, 3, 4, 5. And again, 1, 2, 3, 4, 5. Out, 2, 3, 4, 5. Okay. Everything sounds good there. If you can reach out your hand for me. Okay, let me go ahead and put that down. Okay. Let me go to the monitor. Okay, perfect. 1/6 over 7. Alright, and I'll be back. I'll go get the stuff for the blood draw, okay? Okay, so we're gonna go ahead and take your blood right here. Which arm would you like me to do? Your left? Okay, perfect. Okay, I'm gonna go ahead and wipe down that arm. If you can put your sleeve up for me, please. Alright. Okay. I'm gonna wrap this around your arm really tight. Okay. I'm going to take this back, and we're gonna go ahead and get your blood draw here. Okay, it's done. I'll send that off to the lab, and you should have those results within 2 to 3 days, okay? All right, go ahead and get you bandaged up here. There we go. All right, well, did you have any last minute questions or comments for me before I let you go? Okay, perfect, and depending upon those blood results, we may or may not call you back in, okay? If it shows something abnormal that we would like to discuss further, then perfect, we'll go ahead and call you. If not, you don't need to come back, okay? All right, it's nice to meet you. Okay, bye-bye. Pick up or drop off? Pick up. What's your name? Maria Claring? How do you spell that? C-L-E-R-I-N-G. Date of birth? 08/16/2002. Okay. And Maria, I don't see anything for pickup today. What did you need? The bupropion? Give me just a minute here. Okay, it looks like the bupropion isn't to be filled until the 25th, so 5 days. Well, it says it's not due for refill until that time. Yes, your doctor put a prior authorization in place for them. It'll be 30 days on the 25th from when you last picked it up. Okay, so you're needing it right now. Well, I can ask the pharmacist if maybe he can give you a temporary supply until the 25th, but we really can't refill it right now unless your doctor gives a prior authorization. But we can go ahead, and they won't provide that until the 25th. So I can go ahead and ask the pharmacist to go ahead and give you 4 or 5 pills until then. Is that okay? Okay, perfect. So I'll do that. And then was there anything else you needed to pick up? Vitamin D? Okay, I don't see vitamin D on here either. Let me look. Okay, there it is. All right, so it says in my notes here that the doctors only prescribed you to that for a temporary time in order to get your levels up, and now it's not appropriate to refill. You can reach out to your primary care about it, but that's what we have here on our end, and they're not going to approve it again. Yeah, if you have any questions for the pharmacist about other options, I can let you talk to him, but on my end, I cannot refill it at this point. Okay, so do you want me to go see if I can give you temporary of the bupropion? Okay, perfect. Let me go get the pharmacist. Okay, he went ahead and prescribed you that. Let me go ahead, get my gloves on so I can double check the count here. And did you want to use that card on file? Yeah, we will charge you $1 each pill, so we'll charge you $5 today. And then did you want to speak to the pharmacist about the vitamin D? Okay. Like I said, we could send a PA to your primary, but more times than not, they only fill those for a temporary amount of time. So, okay. Go ahead and count. Okay, there's 5 days supply here, okay? Any questions for the pharmacist? No? Okay. All right. And you did want to use that card on file? Okay. Oops. Looks like it's not going through. Do you have another card we could use by chance? It's gonna be $13.75 today. $5 for the pills plus the $7.50 charge of your yearly membership. Okay, what's that new card number? 5112 3445 8226 7780. Okay. And expiration date. Okay. And what's that 3-digit security code? All right, perfect. There you go. Have a great day. Okay guys, so that was my quick little rendition of a pharmacy tech at the drive-thru, and usually they can be very annoying. So what I decided to do is more of a comedy after this, since this one was really short. I think I can do a comedy, so I'm gonna go ahead and do a comedy one, okay? So hopefully this is entertaining for you guys, but we'll see. So the setting is, let's do CVS. The setting is CVS drive-thru, and the line's been super long. You've been waiting for like 2 hours. Okay, so let me get into character. Now this is supposed to be comedy, guys, so brace yourself. Yeah, I'll be right there. Just a second. Pick up or drop off? Pick up. Date of birth. Name. Okay, I don't show anything ready. What are you here for? The what? I'm sorry, I can't hear you. The sertraline? Do you have another account with us by chance? Because it's not showing up here. What's your middle initial? Okay, can you repeat your name then for me? Tiffany with an A. Okay. Middle initial M. What's your last name? Denning, how do you spell that? Okay. And what's your address? I said, what's your address? Okay. No, we're not seeing anything for you here. I've looked 3 different accounts that you're associated with. I can't find anything, so. What's your phone number? Okay. What is your mother's maiden name? Because, ma'am, we have to check the whole system to see. We might be missing something. Toning? How do you spell that? Okay, and do you have a family member by chance that may have already picked it up? No? The pharmacist is busy. He can't help right now. Well, I'm sorry, I really can't help you at this point. Okay, I can try one last thing. What is your grandma's, uncles, cousins, granddaughters, sons, best friends, mom's, puppy's name? Okay, well, if you don't have that identifying piece of information, then we can't continue. Well, I don't know how much longer the pharmacist is gonna be, so you can pull around again. We close in about 2 hours, so no, you cannot have a temporary supply. We don't do that anymore. No, we don't call for PAs unless we have something indicating in our system. Bye. Okay, guys, so that was kind of quick too, but like that's probably a relatable scenario in any case, maybe not just pharmacy tech, but they want to know 1,000,001 questions, you know, so it's just crazy sometimes. But I hope maybe the typing sounds and some of the glove sounds and hopefully my voice was at all relaxing. And again, keep the requests coming. I may not be able to get to your requests right away, depending on how many I have. I'm still working on them, but I can guarantee we'll get to it at some point, okay? So, all right, well, this was another quick little video. I promise I'll start to make longer ones. I do have a request out to make a longer version of the organ harvester scene, and I will be working on that as well. So just let me know what else you'd like to see. It can be medical related, it can be, you know, a therapy sketch, a comedy sketch, you know, page turning, whatever trigger you want to see, I'm down to try it, okay? All right. Peace. Why, hello there. Welcome to Stacy's Eye Clinic, rated number 5.0 on Yelp. That's a personal best. So, I hear that you have blurry vision, is that correct? Okay, we're gonna fix that problem, okay? Just go ahead and sit in the seat there. I'm gonna go ahead and have you read off these things. I'm gonna have you try it with your naked eye first, and then with these lenses second, okay? Alright, perfect. Can you read the first line here? Fuckyou? Fuck you? Correct. Can you read the second line? A-R-E B-E-A-U-T-I-F F-U-L. You are beautiful. Thank you. That means a lot. I think so too. Can you read the third line at all? Whatever, lady. E-V-E-R-Y. H-A-T-E-S. Good. Good. M-E. Good. Good. Everyone hates me. You know what? That takes a lot of self-awareness. I'm proud of you. But we'll get better. What about this line here? Okay. I-S-T-I-N. Okay. 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 I stink. Good job. You don't stink. You smell fine to me. What about this line? I-A-M-D-U. Is that an N? B-A-N-D. B-L-I-N-D. I am blind and dumb. Very funny. Oh, don't say that about yourself. And you're not blind. We're gonna fix it. What about this very last line? I can't see that line. It's all mushed together. You can't read it? Not at all? Okay, try these. Try them. Try them. Okay. Thanks. IWILPATENDOLLARS. I will pay $10,000. You will? Oh, I'll set up Venmo after this. All right, now let's switch to this one. Read them until you can't anymore, and then use the ones that I gave you. What is this line here? I-A-M-A-N-N-O-Y-I-N-G. I am annoying. I can agree with that. There's other things I'd like to be doing right now. It's okay. What's the next line? I'm not falling for this one. Y-O-U-A-R-E-B-E-A-U-T-I-F-U-L. You are beautiful. Thank you so much. What about this third line? I-C-A-N-T-H-E-L-P-Y-O-U. I can't help you. Clearly. No, I can help you. Don't say that. What about this line here, the fourth line? I need these. Y-O-U-S-T-I-L-L-O-W-E-M-E. You still owe me. What? So you're gonna pay $10,000. We can set up a payment plan, and you're gonna give us 5 stars on Yelp, correct? Well, we'll talk more about it after. So, these glasses seem to be working for you, huh? Want to try them on again? Beautiful. Can I take your eyelid and put it down? Now, please, don't blink. Right, can I do the other eye? Don't blink. Okay, now I'm gonna pull your lid up. Okay, I'm gonna do the other eye. Me. Look to the other side. Look down. Look up. Perfect. Now close this eye and tell me what this line up here says, the second line. A lot of compliments today. Okay, now cover your left eye and read this second line for me. Oh. Oh, stop. Which eye was better? Are we done? Oh, no, we still have 2 lines left. What about this one? GIVESFIVESTARSONYEL. Give us 5 stars on Yelp? Not a chance, lady. Now, these will cost $10,000, but you did agree to pay that, right? You spit out you were a genius a lot faster, because I am a genius. That's why I'm gonna get your money and your 5-star rating, right? Just kidding. Okay. So, I am going to put a stronger lens in the left side and balance it out to 80/2 on the right lens, okay? Are those glasses actually gonna work? Okay, perfect. All right. Hey Maya, so I hear you're a new patient. Perfect. There's no need to be nervous. I know a lot of people hate coming to the dentist, but it's really not bad.
Make sure your tongue's up. Thank you. Okay, good job. Okay. Now what we're going to do is we're going to switch to our varicose tool. And I'm just going to fill it up with some fluoride, okay? Would you like chocolate or bubble gum? Bubble gum. Okay, perfect. All right, get that down. All right, let's get that in there. Perfect. All right, open
so much for showing up today for your consultation. Now just know how this works is I'm going to run through some of what will be charging you if you do decide to go through with braces. We're going to take exams of your teeth and your mouth to make sure that you're ready for the braces, and we're going to talk to you about the results, and then depending on what the orthodontist thinks, we can either start treatment today or whenever the orthodontist suggests. There may be a case where you need to get a tooth pulled first or your bite readjusts, but he'll be the one. So, let me look through my files. It's Meredith Pinko, correct? Okay. Perfect. And what is your date of birth? 05? Okay. Yes, I am going to start out by, checking your mouth, checking your gums. I'm not going to send you to the chair yet, but I am going to look inside your mouth real quick, and then I'll walk you back and get those x-rays started. Just relax. There's no need to be nervous. Are you excited about the braces or more scared? Oh, you're excited. Yeah, braces are cool. Okay, open wide and say ah. You can inspect your teeth and your mouth. Okay, everything looks pretty good. I do see that bite at the front and a few of the molars at the very back, which is affecting your jaw really bad. So, I'm gonna go ahead and do the x-rays. Let's see here. Open real wide for me. This and that side real wide. There you go, and then this other side. Okay, hold real still for me while we get those pictures, okay? Real slow. Don't move your head. Okay, perfect. I will send those, let me get those out. I will send those to our orthodontist and we'll get back to you, okay? Now, before I let you head back to the waiting room, I do want to discuss some braces with you and kind of what your options would be. Okay, so this is our mold of a mouth. Essentially, these teeth are pretty straight, but as you can see, they do have some gapping in between the teeth here. But what I'm going to show you is we have our metal braces, which is a wire that would go on your mouth, such as this. Okie dokie. So this is what your braces would look like on your teeth. See? Now this person could probably get away with Invisalign just because it looks like it's more of a spacing issue for her, but she does have really good alignment, okay? So that's your first option, is the metal braces. Now, I can show you what Invisalign would look like on your teeth. sometimes these are the best choice, other times not so much. We do encourage the wire braces just because they tend to be a little bit more effective on more extreme cases, which it looks like you might need. But yeah, that's this. Don't be nervous. They're not as uncomfortable as they look. Okay, and then we also have this mold here. Now, you can see that these teeth are straight and have good spacing. However, they're not shaped properly. And we also do the fillers. If you would want that down the line, we can refer you to a specialist that does that. So, but that's just if down the line be interested. So yeah, and these can also, sometimes your retainers can look like this, and you always want to wear your retainers after you get your braces off, okay? So, and this is what your retainer case would look like. It is what your Invisalign box would look like if you choose that, okay? And Mom, Invisalign's gonna run probably about $400 every month. They are a bit more expensive than regular braces, but they can be the most effective option in some instances. Now the braces are going to be more like $325 a month, give or take. So yeah, and from what I saw from the few x-rays, it doesn't look like there's that much, just kind of the bite issue, which again kind of makes Invisalign a little bit more hard, but you're excited. All right. Well, like I said, the orthodontist is reviewing those results, and she will get back to me, and I'll come explain those results, those findings to you, okay? Alrighty. Ready to hear the results? Okay. Well, you do need braces to fix that bite and that back alignment. You need them on the top and the bottom, and we can put them on as soon as today. There was no pending issues, no teeth that needed to be pulled, no expanders needed, so we can put those puppies right on. Is after lunch okay, Mom? Okay, perfect. Now, do you need someone to go over the pricing with you again? Okay. Now, top and bottom combined would be around $325 a month. And the orthodontist also said it looks like she may need around 10 to 12 months of treatment, but we'll have a more accurate estimate as treatment goes on and see how her teeth are progressing, okay? Alrighty. Well, let's go ahead and get those braces on, huh? Okay, just give me 1 second. Okay, so here's the wire that I'm gonna put on you, okay? But before we do this, we have to take some impressions of your mouth. Now, lucky for you, we don't have to do the molds anymore. We don't have to stick all that gunk in the back of your teeth. That takes forever to get out. But I am going to give you some solution that will help make the base for your wires a little bit better. Okay. So, you can open real wide for me. This is gonna spit out some solution. Okay. Hold real still for me. loud. Here's a wipe to have with you, just so if you drool, you can have that. Okay, now, open up real wide again with the bottom. Okay, perfect. Now, what we're gonna do is I'm gonna take those molds, and you can also stick these two cotton pads in the back of your mouth, just to dry up anything left over in there. Or you can use this rinsing cup and go spit out in the water fountain behind us, okay? Perfect. Okay. Alright, are you ready for the braces? Okay. It's not as bad as it looks. It's not as bad as it looks. Okay. So, we've got your custom wire made to fit your mouth, and now this is going to go on the bottom part of your teeth, okay? Alright, let's put that on there. Hold real still for me. You're doing great. You're doing so good. Just relax. Let's get the pliers. Glue that's going to go on your teeth, okay? Open real wide. Gotta be real strategic about this. This is how your braces are going to stick to your teeth. Alright, perfect. Okay, let's get this on. There we go. How's that feel? Is there any poking? Okay, perfect. Now let's do the top one. Open your real wide and lean your neck back. Perfect. Hold real still. Perfect. They're all set now. Now these may feel a little awkward for the first couple of days. And if you're feeling any pain at all, just take a couple Tylenol and that should go away, okay? And if there's any poking or anything down the line, you call us and let us know. And we also have some solution that you can put on a poking wire while you're waiting for an appointment with us, okay? And I'll give you some of that before you leave. How was that today? I hope it didn't hurt you. You're such a good patient. I can't wait to see you back. Now, I do want to send you guys home with some paperwork. So, the orthodontist wanted me to give this to you. And did you already give the front desk the other papers? Okay. So this is the other paper that we need. And I'm going to place my signature. If you could just sign this for me, Mom, that'd be great. Alright, sounds good. If you just want to sign out at the front desk, that's fine. We're not going to do the rubber bands with it today, just because we want to make sure you're getting used to those wires and see how your teeth react to just those, okay? Alright, now your next appointment is going to be in about 2 months, just because we like new clients to go a bit longer so they can get more of a feel with it first. So go ahead and schedule that appointment with the front desk, and they should be able to help you. Okay? Alrighty. Thank you so much for visiting our new clinic. It means so much to us. Go home, get some rest, take some Tylenol if you need it, and remember, if anything starts poking, you let let us know, okay? And we are going to give you some solution before you walk out. In fact, I think I'm going to get it now. Here's some solution that you can put on those poking wires, okay? Now, I don't expect you to have anything go wrong, but just if they do, you can use this in the meantime, okay? Alrighty. It was so nice with you today. And actually, one last step, I do kind of want to rub this brush in the back of your mouth just to make sure that those wires are all good and nice. Yep, they are. Alrighty, well, it was so nice meeting you. Alright, now you take care, okay? And we'll see you later. Hi, Margaret. How are you doing today? Fabulous. Now, how is that cancer treating you? Have you noticed the signs going away and all that? Okay, good. Now, your chemo is done. It's in the books. Your breast cancer's gone. It's completely gone away. Now, we're giving you the choice of either going on radiation or not going on radiation. Now, I will tell you, if you do not choose to do the radiation, there's a chance that your cancer could spread and come back. Now, if you do the radiation, there's an 85% chance that you'll be fine for the next 5 to 10 years at least. So, radiation would include 10 more sessions, and they would be treated the same as chemo, but with different drugs administered. So same protocol, same procedures, but this time we would monitor you more, depending on how you reacted to the original chemo dose the last time. So that's all right there in our records. Do you have any other questions? Okay, we're not going to make you make that decision today, but if you want to get with a couple of your family members, maybe have them call me, bring them to the next appointment, we can all discuss this in more detail, okay? But are you still drinking tons of water? Okay. Now I am going to administer you the B12 vitamin, and I want you to go to the store or have someone pick up for you 2 bags of spinach, okay? Okay, because looking at your last vitals, it does look like you were low on, you were iron deficient, so that's going to be good to get that up. And so yeah, the radiation will last 10 treatments, and depending on how we separate it out, you could be done within the next 5 months, completely done with everything, okay? Now, the radiation can cause side effects. So that's why we're giving you the choice whether or not to do it. All right. Now, here, it does show on my tablet here that one of our nurses wanted you to come back in for an MRI scan. She saw something on your kidney, but she said, no, it's just totally minor, totally minor. They don't know what they saw. It could just have been a shadow on the screen. But, you know, they're all very overprotective, and, you know, they really just want to rule everything out. But I have never seen a patient that had breast cancer have it spread to their kidneys. So this is probably something normal, but we want to get everything checked out, okay? All right. But overall, everything else right now, as of now, you're cancer-free. Everything looks super healthy. And yeah, that's the only upcoming appointment that I see on here is for that MRI. So I will contact them and try to get back in contact with you with what I find out. But for right now, I will tell you that if you decide to do the radiation, I do not want you driving during that time, okay? Because, right, it's just, we'd rather be safe than sorry, okay? And we can go into more radiation in detail the next session. I don't want to overload you today. Just enjoy being cancer-free and know that you have this option waiting for you, okay? All right, is there anything else that you wanted to discuss? Okay, can I go ahead and get your vitals real quick while I have you here? Okay, perfect. Now make sure you're eating very healthy foods, taking your vitamins, drinking lots of water, and that will prevent the cancer from spreading as well, right? Depending upon the patient, put your hand out for me, please. I'm actually gonna wrap your arm real well so I can get a better read on this. Okay, perfect. 120/2. Your blood pressure is right on point. That's amazing. Now, I'm sorry, Margaret, you're not gonna like this, but I do want to administer a quick little shot in your arm. Because it says you haven't had your 12 months vaccine yet. And I really want to go ahead and get that done. If you were to start radiation, we'd want to get it done before. Is that okay if we go ahead and do that? Okay, perfect. You can get your, if you could stick your hand out to me, please. That'd be awesome. Down the area. Is this arm okay? Okay, perfect. Down the area, real good. Now this isn't gonna hurt. It'll just be a quick pinch, just like any other shot, flu shot, whatever. Okay, hold your arm out real still. Okay, 1, 2, 3. All right, perfect. Would you like a Band-Aid for that? No? Okay. All right, Margaret. Well, my #1 instruction for you is to relax. Go home, take a warm, hot bubble bath. Maybe put in some lavender scents, some rose scents, whatever you like. And I want you to lay back and I want you to enjoy the water and the soap. And then I want you to take yourself out for a good meal, okay? I want you to have crab legs, your favorite food, chocolate cake, whatever makes you feel good. And then I want you to plan a trip with your family to celebrate you being cancer-free, okay? Go get a massage. And also, can I check your heart rate? Okay, thank you. Check your heart rate real quick. And breathe in real quick. Big breath in. And big breath out. Again. Big breath in. And big breath out. Last one. Big breath in. And big breath out. Perfect. Okay. Well, it looks like your heart rate's pretty good, steady. Everything looks normal. So you're doing all the right things. Just keep it up. Is there any other questions you had for me today? Okay. All right. Yeah, but like I said, I do want to send you home. And I do want to have you sign anything also. So yeah, like I said, go home, go shopping, go to your favorite store, relax, get a massage, sit in a sauna, eat some ice cream. You focus on you, okay? Because you deserve it. Okay. Go ahead and sign. Go ahead and sign this for me here. I'm going to go ahead and put my signature. If you can sign that we discussed radiation today and your MRI appointment, that'll be awesome. All right. Perfect.